Overcoming Brain Cancer, Professor Chen Hailin, China's most authoritative expert. Brain tumors, also known as intracranial tumors, can occur at any age and are divided into two categories, primary and secondary. There are more than 120 types of intracranial tumors, accounting for about 5% of systemic tumors and 70% of childhood tumors. However, 20% to 30% of other malignant tumors will eventually migrate into the brain, and the prognosis is extremely poor. Although there is no name for brain tumors in traditional Chinese medicine, according to the clinical manifestations of brain tumors, this disease can be seen in headache vertigo vomiting stroke epilepsy and other diseases. The experience of using traditional Chinese medicine to differentiate and treat this disease is introduced below. Among the many factors that cause tumors, the imbalance of yin and yang is the most fundamental cause. On the one hand, the brain is the organ of the yuan shen, where the true qi gathers, and the true qi is the yuan yang. On the other hand, the brain is the sea of marrow, which is filled with kidney essence, and is the home of the yuan yin. The true qi and marrow of the brain fluid is related to yuan yin and yuan yang, and the imbalance of yin and yang is the basic contradiction that causes brain tumors. On the other hand, the strength of righteousness and the rise and fall of evil qi determine the treatment and prognosis of the disease. For patients with brain tumors after surgery, radiotherapy, chemotherapy or late-stage conservative treatment, depending on the rise and fall of evil qi, clinical manifestations, tongue and pulse, etc. Distinguishing between deficiency and excess plays an important role in the patient and APO's disease outcome. Therefore, the syndrome differentiation of brain tumors should first differentiate between yin and yang, and then differentiate between deficiency and excess. The human body is an organic whole. Brain diseases can affect the 5 internal organs, and similarly, diseases of the 5 internal organs can also affect the brain. Therefore, the diagnosis and treatment of brain tumors can be based on the internal organs, such as the brain and liver. Patients with brain tumors have symptoms such as dizziness, convulsions, headaches, and madness. By cooling the liver, Ling Shu times Hailin, says, if the marrow qi is insufficient, the brain will turn, the ears will ring, the shin will be sore and dizzy, the eyes will not be able to see, and you will be lazy and sleepy. Because the kidney controls the bones and produces marrow, which fills the brain. If the kidney essence is insufficient, if the marrow qi is deficient, symptoms such as dizziness, tinnitus, low head, mental fatigue, inability to stand for a long time, and unsteady walking will occur. The treatment should be to replenish the essence and nourish the kidney. If the kidney essence is replenished and the marrow qi is nourished, then the brain and marrow will replenish themselves and the encephalopathy will heal itself. Liwei de Huan pills are used for treatment. For those with kidney yang deficiency, Chinci pills, Morinda officinalis, Cascuda japonica, or Shinchi pills are often used. For those with kidney yin deficiency, Auger pills, Ligustrum lucidum, ecliptosemen, are often used. Or Debian pills as the main additions and subtractions. And quote, Lingshu Times Cohen and quote, says, and quote, if the upper qi is insufficient, the brain will be dissatisfied, the ears will ring with pain, the head will tilt with pain, and the eyes will be dizzy. And quote, the upper qi refers to the true qi of the brain. Insufficient shangqi means that the daily energy of the mind is impaired, nutrients and blood are depleted, resulting in insufficient brain energy and loss of nourishment for the brain. Symptoms such as tinnitus, head tilt, dizziness, forgetfulness, mental fatigue, timidity, and even numbness of the limbs are serious. Fainting may also be seen. The treatment is suitable for nourishing the middle qi and raising and regulating qingyang. Because the true qi of the brain is formed by the transformation of innate vitality and acquired water and grain essence, the water and grain essence is the middle qi. If the middle qi is filled and the vitality is sufficient, the brain qi will be self-sufficient. We often make our own prescription a yuan decoction, ginseng, astragalus, poria, polyporus, wolfberry, ligustrum lucidum, addition and subtraction treatment. If the wei yang is not strong and spontaneous sweating occurs, the dosage of astragalus can be increased, and the addition of windproof, floating wheat, etc. can be added to stabilize the surface and stop sweating. If the qi and blood are deficient, the complexion is dull, the heart is palpitating and insomnia, the Rehmannia glutinosa, Donkeyhide gelatin, and Polygonum multiflorum can be added, etc. to nourish yin and blood. If qi deficiency and yang are accompanied by symptoms of yang deficiency such as aversion to cold, cold limbs, and dull pain in the abdomen, cinnamon twigs, dried ginger, aconite, etc. can be added to warm and replenish yang qi. The brain is the most pure organ, and evil cannot invade it, otherwise it will cause illness. If the qi function of the organs is not smooth and the circulation of body fluids is blocked, resulting in phlegm, the phlegm obscures the clear orifice. Ji Yunla, female, 69 years old, is a human resources officer at Beijing Long Distance Bus Company. The patient was admitted to the Army General Hospital on December 14, 2018 due to multiple gliomas and intracranial occupancy, and underwent a week of relevant examinations. I had brain tumor surgery. 2 large brain tumors were removed on the morning of December 21, 2018. I had surgery on the morning of December 21, 2018 and was discharged from the hospital 2 weeks after the operation. Transferred to Yanda Hospital on January 7, 2019, after the second and last 10 radiotherapy treatments in March 2019, a total of 30 radiotherapy treatments, the patient became paralyzed and became a vegetative state, losing all functions, swallowing, speech, and blindness. Lost consciousness, stiff limbs, relied on artificial help and sensation to defecate, and was unable to wake up. The skin color begins to fade. After diagnosis and rescue treatment by many neurologists and directors from Beijing General Hospital, Qiantan Hospital, and Beijing Cancer Hospital, the patient and APO's condition did not improve at all. After being transferred to the hospital and treating the relationship with other hospitals, it was finally reported as a failure. At the critical moment, the insider asked Professor Chen Hailin for help. Professor Chen Hailin arrived in Beijing by plane at 8:10 a.m. on May 31, 2019, and went straight to the neurosurgery department of Yanda Hospital. When I saw the patient Jie Yongla, I carefully observed the patient and Apo's complexion, demeanor, breathing, blood pressure, blood nourishment, and heart rate, and treatment status in the past 2 weeks. The family members were extremely worried when they saw that the patient had not looked straight for more than 70 days. They urgently needed the patient to open his eyes and see everything about Juju. At around 8:00 and Apo's clock in the evening, Professor Chen Hailin began to treat the patient with Chinese herbal decoction. At this time, the family members began to worry, fearing something might happen. Professor Chen Hailin also expressed that he was really in trouble and encouraged his family many times. After an hour or two, everything was normal. He continued to observe, check body temperature, blood pressure, heart rate, epilepsy, and prevent accidents. Finally, 10 hours passed and there was shocking news. Jie Yongla finally opened his eyes, and his family members and surrounding hospital staff saw it. When the director of the neurology department of Beijing Hospital and the director, who had returned from studying abroad, were unable to do anything, the patient opened his eyes with the treatment of Chinese herbal medicine. From then on, the patient had to open his eyes and look at his entire surroundings every day. Because the ventricular damage was extremely severe, recovery was almost nil. In order not to affect the interests and effectiveness of the hospital departments, we still respect other people and Apo's requests. Entering January 2020, the new coronavirus pneumonia started nationwide. Hospitals banned outside admissions. Professor Chen Hailin was unable to enter the hospital. He interrupted the treatment of the patient and had no choice but to give up. However, the patient and Apo's eyes were wide open. Kui Jixiang, male, 63 years old, from Danzhou Town, Changxi County, Shaanxi Province. Brain metastasis from squamous cell carcinoma of the left lung, stage TCNOM1CVB. Came for treatment on April 28, 2022. Chief complaint: frequent wrestling, radioactive vomiting, and headache that has worsened for a week recently. History of current illness: due to a history of cerebral infarction, he occasionally had symptoms such as mild wrestling, headache, and vomiting. Admitted to Shaanxi Cancer Hospital on March 25, 2022, a series of related examinations, tests, and other related procedures were carried out in the hospital. And true short-term treatment of the condition. Discharged on April 19, 2022, discharge diagnosis: left lung squamous cell carcinoma, brain metastasis, TCNOM1C1VB stage, PIK3CA gene mutation, hepatic cysts, chronic gastritis, reflux esophagitis, thyroid nodules, cardia high-grade intraepithelial neoplasia. weight loss, yellowish complexion, fatigue, chest tightness and shortness of breath, headache and dizziness with history of high blood pressure and cerebral infarction, numbness in the left half of the body, vomiting, insomnia, anorexia, dry and hard stools, red tongue with sticky coating, and slow and stringy pulse. Slip. History of tobacco and alcohol symptoms, phlegm and dampness blocking collaterals, brain and kidney insufficiency, lung insufficiency, and body fluid loss. Syndrome differentiation, diuresis and phlegm, dispersing lung and dissipating stagnation, nourishing the brain and kidneys, replenishing qi and nourishing yin. The obvious symptom of this disease is that the brain tumor compresses the peripheral nerves, causing numbness in the left half of the body. While treating lung cancer, control the respread and metastasis of brain tumors. While treating lung cancer, we should pay close attention to brain metastasis. Pay close attention to the pathogenesis, use appropriate medications, and adopt a combination of oral and external use. After 2 months of pure Chinese medicine treatment, the numbness in the left half of the patient and APO's body disappeared naturally, chest tightness and shortness of breath gradually decreased, and the headache and dizziness were better than before. The patient felt good about himself and requested re-examination on June 29, 2022 at CT examination report from Changzhou County Hospital of Traditional Chinese Medicine, the brain tumor disappeared. At present, the patient and APO's brain metastasis has been treated with pure traditional Chinese medicine for 2 months and has been clinically cured. His family requested that the medicine be stopped for 3 months before being examined again. The second CT examination report of traditional Chinese medicine in Changzhou County on October 22, 2022, skull flat scan imaging findings. Spot-like low-density shadows with unclear edges were seen in the bilateral basal ganglia, patchy low density. Shadows with unclear edges were seen in the right frontoparietal lobe and temporal lobe, no obvious enlargement of the ventricular system, and cerebral sulci were seen. The crack has not been significantly widened or deepened, and the midline structure is centered. Imaging diagnosis: 1. Bilateral lacunar cerebral infarction in the basal ganglia. 2. Multiple edema in the brain. Please compare with the original film. At the same time, lung cancer and other basic diseases were effectively controlled and reduced. Comparing the before and after examination reports, 2 months of pure Chinese medicine treatment resulted in a clinical cure. Patient Wen Yuzhao, male, 53 years old, from Hebei. Multiple myeloma. The patient went to Professor Chen Hailin for treatment on August 16, 2022. Chief complaint: low back pain for more than 2 years, low back pain for half a year, paroxysmal head pain for more than 10 days. The cytomorphological examination report showed that the current bone marrow imaging showed a significant increase in plasma cells. On the same day, another MR examination was performed, and the report showed 1. Multiple abnormal signals in the thoracolumbo-sacral vertebrae and their accessories. Combined with the medical history, it is consistent with the manifestations of multiple myeloma. 2. Flattening of the 12th thoracic and 2nd lumbar vertebrae. 3. Degeneration of the lumbosacral intervertebral disc. 4. Protrusion of the 4th lumbar vertebrae. 5. Protrusion of the lumbar 4 to 5 intervertebral disc with protrusion. Imaging findings: multiple round low-density areas of different sizes in the skull. Imaging observation: multiple round low-density areas in the skull, consistent with multiple myeloma changes. CT diagnosis report on July 22, 2022, plain chest CT scan, imaging opinion, abnormal density of thoracic spine, ribs on both sides, and scapula on both sides, combined with medical history, consistent with multiple myeloma manifestations. 2. BN changes in some thoracic vertebrae. 3. Scattered lung strips. 4. Abdominal lesions. Followed by bone marrow pathology report on July 27, 2022, diagnosis: extraplasmic myeloma. Combined with clinical and other examinations, as well as blood and biochemical index examinations, relevant examination materials are completed, and the patient will be discharged on August 6, 2022. 1 week after returning home, on August 16, 2022, under the leadership of an insider, I went to Professor Chen Hailin for treatment due to headache and dizziness. First visit: medium body, hunchback, inconvenient walking, vomiting, headache, eye swelling, red tongue with sticky coating, slow and stringy pulse, history of hypertension. Syndrome differentiation: brain and kidney insufficiency, liver and kidney blood deficiency, body fluid consumption, overstrain. Treatment method: invigorate the spleen and stomach, invigorate the kidney and liver, invigorate the brain, dispel stagnation, and used to be able to sit completely, but my back hurts when I sit, my head hurts, the pain is unbearable, my bending is better than before, and my height has increased to 156 centimeters, riding a bicycle into urban and rural areas casually. Since the end of the examination on October 20th, the patient has described that all physical indicators have returned to normal and has returned to normal life. Physical and chemical carcinogens and viruses in the modern environment invade the human body, affecting the smooth flow of qi and blood, blocking the brain meridians, causing persistent headache, forgetfulness, hemiplegia, aphasia, or madness, dark purple tongue, and tongue surface. Ecchymoses, stases in sublingual collaterals, stringy pulse, etc. Treatment should be to activate blood circulation and dissipate blood stases, soften hardness and dissipate stagnation, and make brain collateral qi and blood unobstructed, so that brain tumors can be easily eliminated. Tongqiao Huishua decoction is often added or subtracted. If you also experience fatigue and weak pulse, indicating qi deficiency and blood stases, you can add astragalus, dangshen, etc. to nourish qi and promote blood circulation. If you have a severe headache, you can add bamboo silkworm, earthworm, whole scorpion, etc. Centipedes and other insects search for wind and dredge the collaterals. The liver body is yin and uses yang to store the soul. If the spirit and emotions are imbalanced, the liver fails to relax, the qi is stagnant for a long time and turns into fire, the liver yang is excessive, disturbing the clear orifices, and the liver and kidneys are deficient in essence and blood, and the water does not contain the wood. When yang qi stagnation turns into wind and rises up to disturb the mind and occupies the position of clear yang, it will appear as headaches and dizziness, tinnitus and dizziness, upset and irritability, flushed face and eyes, insomnia and dreaminess, numbness of limbs, etc. Treatment should be to calm the liver and subdue yang, and tonify the liver and kidneys. Gastrodia and carrier decoction is often used for treatment. If the yin deficiency is severe, Arphiapagan japonicus, scrofulariaceae, Rehmannia glutinosa, etc. can be added to nourish the yin of the liver and kidneys. For constipation, rhubarb and glauber and apose salt can be added to relieve heat in the intestines. If there is dizziness, nausea, vomiting, and tremors in the hands and feet, if so, you can add keel, oyster, mother of pearl and other products that calm the liver and calm the wind.